Thank you, Mr. Speaker. My question is for the Premier. Last week, the government announced the list of hotspots, but that list left out some of the hardest hit areas in Hamilton. Hamilton's Chief Medical Officer asked that additional postal codes be added. She was denied, so she added them herself. Our public health units are trying to implement this government's announcement, but they need support. Right now, Hamilton is behind some of the neighbouring regions when it comes to vaccinating eligible groups. Will this government provide Hamilton Public Health whatever support that it actually needs to get this job done?
The Parliamentary Assistant, member for Eglinton Lawrence, to respond.
Thank you, Speaker. Our government has been clear. Phase 2 of our vaccine rollout will be focused on older adults, those at risk of serious illness, and our hotspot areas. And this approach is designed to save lives, protect those at risk of serious illness, and to stop the virus from spreading. And let me be clear, hotspots have been identified based on historic and ongoing rates of COVID-19, deaths, hospitalizations, and transmissions, and on outbreak data, research and analysis conducted by the COVID-19 Science Advisory Table, low testing rates, socio-demographic barriers that may result in vaccine hesitancy. All of these things go into picking the hotspot areas, and we have a number of them picked out, and we have been going at those communities to try to make the vaccinations more widespread in those communities, including in communities that are represented by the MPP for Hamilton Mountain and the MPP for Hamilton West Ancaster Dundas, have been identified as hotspot areas, and as soon as we have more vaccines, we will be in more communities getting those vaccines out.
And the supplementary question.
Thank you, Speaker. Back to the Premier. When the government announced the list of hotspots, it also shared confusing information about who is eligible. I am constantly hearing from residents in my community who don't know if they're eligible and they don't know how to get an appointment. This government has to stop making policy by press conference and actually provide public health units the support they need. Hamilton is still working on identifying people with high-risk medical conditions. These residents are still waiting to get an appointment. Will the government provide Hamilton Public Health more support in getting this done instead of making their work harder and making confusing announcements?
Member for Eglinton Lawrence.
Thank you, Speaker. Our government has been clear. Phase 2 of our vaccine rollout will be focused, as I said, on older adults, those with serious illness, and those in the hotspot areas. We also know that certain communities have been disproportionately impacted by COVID-19, and we understand that administering vaccines to people who live in these areas is critical to reducing the impact of COVID-19 as quickly as possible, which is why, as part of our second phase of our vaccine rollout, we have identified specific hotspot areas in postal codes in 13 public health units around the province. Right now, anyone in Hamilton over the age of 50 in those hotspot areas can register and get a vaccine in those hotspot areas. And across the province, at pharmacies, everyone over the age of 55 can get a vaccine. So there's lots of vaccines available. We want people to get out there and get the vaccines as quickly as possible. We're doing everything we can to make that happen in Hamilton and across the province.